What is the pupillary light reflex test? Imagine a simple flashlight shining into your eyes, but what this test reveals goes far beyond just checking your eyesight. The pupillary light reflex test is a key part of neurological exams used to assess how well your brain and nervous system are functioning. It's especially important when doctors are trying to find out if there's a brain tumor or other brain injury affecting the brainstem or midbrain areas. This test helps doctors see if the nerves and pathways that control your pupils are working properly. Here's how it works. A healthcare provider shines a bright light into one eye while you sit quietly. Normally, your pupil, the black circle in the middle of your iris, will constrict or get smaller in response to the light. This is an automatic reflex controlled by a complex neural pathway. After shining the light into one, the doctor will then switch to the other eye and observe how both pupils react. They look for the direct response, which is how the illuminated eye reacts, and the consensual response, which is how the other eye's pupil constricts even though it wasn't directly lit. For an accurate test, it's best done in a dim room so the pupils are relaxed and easy to observe. The neural pathway involved starts at the retina, where light signals are detected. These signals travel through the optic nerve to the brain. They pass through the optic chiasm and continue along the optic tracts to reach a part of the midbrain called the superior colliculus. From there, the signals go to the pretectal area, which then communicates with the Edinger-Westphal nuclei. These nuclei send signals via the oculomotor nerve to the muscles around the iris, causing the pupils to constrict in response to light. This pathway is vital because it connects the eye to the brainstem, making it a useful indicator of brain health. In cases where a brain tumor is suspected, this test becomes even more important. Because the pathway involves the brainstem and midbrain, any abnormal response can suggest damage or pressure from a tumor in these areas. For example, if both pupils do not respond to light and remains dilated, it might indicate a severe brainstem injury or a tumor affecting those regions. Sometimes, a tumor near the pineal gland or in the midbrain can interfere with the reflex pathway, leading to abnormal pupillary responses. The swinging flashlight test is a special version used to detect a relative afferent pupillary defect, which can show if one optic nerve is damaged or not transmitting signals properly. Modern diagnostic methods have added more tools to this assessment. Dynamic pupillometry uses specialized equipment to measure pupillary responses precisely, even detecting subtle changes that might not be visible to the naked. These advanced tests can help identify early signs of neurological problems and monitor disease progression or response to treatment. When the pupillary reflex is abnormal, it can tell us a lot about what's happening inside the brain. Pupils that are small but reactive might suggest metabolic issues or drug effects. Dilated and unresponsive pupils often point to serious brainstem damage. If only one pupil is affected, it could mean damage to the optic nerve or oculomotor nerve on that side. The test also helps differentiate between structural brain issues and other causes of neurological symptoms. The pupillary light reflex is more than just a quick check. It's a window into brain health. In patients with altered consciousness or coma, it provides critical clues about brainstem function. Because it's simple, quick, and requires only a flashlight, it's a routine part of neurological exams worldwide. Regular assessment helps doctors detect dangerous conditions early, guiding further testing like imaging scans and informing treatment decisions. Remember, if you or someone else has concerns about neurological health, it's always best to consult a healthcare professional for a thorough evaluation.